for staying with us at STL Live. I'm Sherry Farmer. We are learning about vaccinations with the Department of Health with my guest health service manager, Candace De Silva, and school nurse coordinator, Surilla Shaw. Now, Candace, before the break, you were, starting to tell us a little bit more about where folks can go for more information about vaccines, but you also have some partnerships to help families out.
Certainly. So we're honored to have a long-standing partnership with People's Health Centers. And actually coming up in August are two great opportunities on August 3rd and the 10th at their Del Mar location where families can come on out, and they're doing back-to-school immunization clinics. Some of our nurses from the health department will be going to support those efforts. So like I mentioned, that would be a prime opportunity for families to come out, get their students immunized in preparation to set them up for success that school year.
So important because we can only give them, based on state law, a grace period. So if a child enrolls and they're not properly immunized or don't have exemptions, they only get 10 days to be in school without an actual exclusion notice being given. Now, if they are what we consider in transition, meaning homeless, they do get 30 days. But along with that, we like to provide them with a list of resources. So Ms. De Silva mentioned People's, but there are others as well that I hope we'll be able to show about 8 areas that they can go to get immunizations done. And we ask that parents please do it before school starts so that their child's education won't have to be interrupted.
Yeah, less stress if you get it done now.
Yes, yes.
And we all know stress is definitely something that could cause a child to get sick as well as their parents. So we don't want that happening either.
That's right.
We're always hearing about
Students
stress.
focus on school and learning and having fun. And so as we look at, again, one of the other benefits of vaccinating, if a child were to get a vaccine preventable disease, that can mean missed work days for parents who have to stay at home and care for the child, and missed school days for students, and that's not something that we want.
That's right. We don't want that.
And I know that it's one of those things that has been in the news a lot, those rumors about immunizations. Can you clear that up for us?
Yeah, a lot of myths.
A lot of misinformation out there, and we want to make sure parents access credible sources of information like their school nurse. The Centers for Disease Control and Prevention offer great links to resources and reasons why parents should vaccinate their children. And so we just want to make sure that we have the right information, it's timely and accurate information for parents.
Right, so myths are very real in people's minds, but the myths aren't based on evidence or scientific finding. They're based more on fears. For instance, if my child gets the measles shot, they'll get autism, but there's no scientific basis for that. I don't like to be super negatively critical of parents and their apprehensions about immunizations.
Well, it's their child. You're
Yes.
gonna feel something. Yeah.
You're going to feel something. In all honesty, like we said, they're going to have had like 14 shots by the time they're 6 years old. And a lot of these haven't been out but more than 20 years. The hepatitis B, and now they got to give them a chickenpox shot. Now they got to give them a meningitis shot. And so some of our parents who are apprehensive, to them, this looks like just something that's being done. But a lot of study goes into whether or not an immunization is needed before it becomes mandated by the state. So it's based on need. If there is a slight chance that an outbreak in this area is about to occur, they will mandate that immunization to prevent that from happening.
Well, I know every now and then on the news we hear about like a flu outbreak, and they'll close a school down because it's just, and it takes so long to clean everything up and get everybody back together again, right? We don't want that happening.
But you've got a growing number of people who are saying, if I get the flu shot, I'm just gonna get the flu. And regarding that, about half of the people, 47% of the people who get the flu shot don't get the disease at all. The other what would that be, 53%? Either get a case of it or a very mild case, but death is prevented.
Yes.
You see what I'm saying? And you've got to keep in mind when it comes to these flu vaccines, the flu vaccine for this year is going to be based on the flu strains from last year. And the flu is very smart. I think the flu is going to always be around.
Yeah.
And it's always going to stay a step ahead, but at least the immunization will give us enough resistance to keep from being so sick. Because in 2018, about 80,000 people died from the flu. And we don't want to be one of those.
No, we want
certainly
Even if we have
everybody
to get
to
it, we
be
don't want it to kill
healthy.
us.
We don't want
So-
that. Yeah,
Yes.
we don't want an
No.
outbreak. And
Right.
let what's happening in some of these other states be a lesson learned for us. In New York City, we see a record number of measles cases. And so we want to assure that an outbreak doesn't happen here in St. Louis. That is made possible by high vaccination rates, meaning lower rates of vaccine preventable diseases.
Yes.
Yep.
They are rigorously tested and evaluated. So I just want to echo again, vaccines are safe and effective, and they're the
Yes.
proven choice to keep your family safe.
So
Yes.
parents, be responsible. The Department of Health provides back-to-school vaccinations to prevent the spread of infectious diseases amongst children. It's located at 1520 Market Street in room 4051 and is open Monday through Friday from 8 a.m. to 5 p.m. For more information, you can call 314-612-5100 or visit stlouismo.gov. There's more STL Live after this, so don't go anywhere.